Thank you very much indeed, Alan, and welcome and good morning, everybody. My title was The Birth and Future Health of DOHaD, Developmental Origins of Health and Disease. It seems a bit odd, though, to talk about birth unless one talks about conception. Where actually was the idea conceived and when? And the short answer is, I don't know, and I don't think any of us know. You can trace it, certainly, back to the ancients. Here's a quote from Hippocrates in his treatise on the nature of the child. Loses a little fluency in translation from the ancient Greek, I have to say. Now, it's just the same, it's just in the same way that the child in the womb lives from its mother, and it's on the condition of the health of the mother that the condition of the health of the child depends. So, in a sense, motherhood and apple pie, something very obvious that just about everybody would agree with. There are many papers in the literature dating back to the early part of the century, which one can see as part of this conception process here. Probably I've missed some key ones, but just to remind you of some of them, Kermack in 1934 linked poor living conditions in childhood to later premature mortality. And then Forsdal, in a series of papers, linked poor living conditions in childhood and adolescence as risk factors for various forms of heart disease, and critically came up with the idea even when the adult environment was not poor. Then there were a whole series of projects and studies by Günther Dorner and others in Germany, which actually introduced the word programming, Programmierung, I think it was in German, and that began the beginnings of a science of some of these ideas. And a very, to my mind, an overlooked paper in one of the early issues of Hypertension by Higgins et al. Reported an association between pregnancy complications, things like preeclampsia, and blood pressure of the offspring. And interestingly, the effect became more exaggerated in older offspring, so it was the beginnings of a life course story, and persisted after correction for mother's blood pressure. And Higgins, in her conclusion, said that the prenatal environment rather than genetic effects were involved, and suggested that future research should involve the prospective study of women and children. Sounds like a pitch for the Southampton Women's Survey. And Wadsworth, a couple of years later, published an inverse association between birth weight and parental social status and blood pressure in young men and women. So some of the seeds were there. But as we all know, it wasn't until David came on the scene, and his early paper here with Clive actually made, if you like, a thought of this, crystallized it all and said, look, there are bits and pieces out there, but there's a story. There is something that we're all overlooking. Nobody should disagree with it. That didn't turn out to be true over the following years, but nobody should disagree with it. And actually, this should be a sea change in our thinking, not only in medicine, but in biology too. And three of the seminal papers in the mid to late 80s are here from Clive and David in the Lancet on infant mortality, childhood nutrition and heart disease. His paper on growth in utero, so the fetal side, blood pressure in childhood and mortality from cardiovascular disease. And then the story of changes in weight in infancy and ischemic heart disease. And in parallel, of course, the movement was growing momentum. Bo Genzer and others working in Sweden came up with similar observations on birth weight and high risk of blood pressure in adulthood in army recruits, and Peter Winkup and others in London looked at childhood effects. So the story was there, and it was very clear from the epidemiology by the mid to late 80s. But David realised that actually this concept was at a crossroads, that you could only take the epidemiology so far, that it was all very well to find associations, but to get to cause and effect, one needed to understand mechanisms. And that was the thing that really took him to make new friends. And some of those new friends are shown in this slide, which is from that period, and it was the change was particularly pioneered by his encounters with Geoffrey Dawes here. These are fetal physiologists meeting over beer, as of course we always did in those days and still do, and I don't know where the meeting is. Here's Geoffrey. Here's a competitor of his actually on the other side of the world, Abe Rudolph, and it's interesting that they're at the same table, deep in conversation about something. I'd like to think this empty chair would have been occupied by David. Here is Geoffrey Thorburn from Australia. Here's Mont Liggins, looking very relaxed from Auckland. Peter Gluckman from Auckland, looking very intense. Chris Redmond's over here, and I'm not sure I can identify this man, but I think it's John Challis, and he can correct me if I'm wrong. We met, I first met David actually at around this time at a CEBA symposium meeting in London, but the critical meeting was led and organised by Geoffrey Dawes in a beautiful place, Lerici, near La Spezia in Italy. This is the bay that the poet, sorry, it's not Byron, Shelley swam out to sea and came back dead. So we had that to follow, but from some funding which was mysterious, but which I think, in tracing it, came from the Italian armaments industry. Geoffrey put together a small group of people to stay for 3 days with lavish hospitality and no audience in a villa overlooking this bay. And I remember very clearly, I think probably on the evening of the first day, walking along the beach with John, and he said to me, you know, Mark, you've got the inside track on this. You work closely with Geoffrey Dawes. What's this meeting all about? And I said, I'm blowed if I know, John, but I think, you know, do you think it's got something to do with this bloke Barker? We've never met him before. Why is he here? And indeed, David gave a stunning presentation at the meeting on the intrauterine origins of adult hypertension. Luckily, in those days, many of these meetings, and this one was published in a book called Fetal Autonomy and Adaptation by John Wiley in 1990. Luckily, in those days, sometimes the discussion at the end of papers was recorded. And it's very interesting to look at some of the comments that followed David's paper, the challenging that we all gave to him. Patrick, that was John Patrick, now sadly no longer with us, from London, Ontario, wondered whether the results might have been distorted by smoking. Redmond, that was Chris Redmond from Oxford, asked whether the association between hypertension in adults and placental weight was genetically determined. Right. Hanson wondered whether the differences which Barker had described would disappear if the data were reanalysed for social class. Stupid boy, of course he'd thought of that. He'd thought of that. And Thornburg, Kent, thought it far-fetched that a short-term adaptation of a fetus in trouble would have such long-term effects on the likelihood of ischemic heart disease in adult life. And Visser, Jerry Visser from the Netherlands, was still concerned about the effects of smoking, as of course the Dutch are. But here's the killer. Nevertheless, Barker stuck to his hypothesis, and he always did, didn't he? Which of course must be validated by further measurements. And this really, to my mind, was, if you like, the ordeal by fire, at least as far as the physiologists were concerned, which he passed with flying colours. And it led to an enormous increase in basic research and in clinical research, as well, of course, as epidemiology, which took the idea further and into the public domain. So that by the time that Caroline Fall and colleagues organised the first international meeting on the fetal origins of adult disease, FOAD, in Mumbai, in India, she brought together not only the epidemiologists and the basic scientists, clinical scientists, developmental biologists, evolutionary biologists, anthropologists, people interested in various aspects of human behaviour, ethologists and so on. It really was a landmark meeting, because of the meeting of minds, and also because it was in India, because I'd never been to India. I know some people, John Noonan, for example, who's not with us sadly today, has often said that was the time when I suddenly understood what DOHaD was all about. Here we were staying in this wonderful hotel with all this wonderful food and hospitality, and then you'd walk out in the street and you'd see India and the problems that it was facing. And so a fantastic meeting which really put the fetal origins agenda on the map. Of course, there are always one or two delegates at a meeting like this that go native and misbehave, and but it doesn't stop them reaching high rank, Professor Cameron. That was followed by the second meeting, excuse me, in Brighton in 2003. And by then, things really had changed. Actually, they changed in Brighton because this pier was burnt down shortly after we produced the brochure, but we decided we wouldn't change the brochure because it didn't look sort of so much of a pull, really, to have a skeletal pier on the front of the thing. By this stage, several things had happened. On the platform at the opening ceremony, we had the Princess Royal, Princess Anne, we had Amartya Sen, the Nobel laureate, we had Lord Robert Winston, we had Colin Blakemore, who at that time was at the helm of the MRC, and many other influential people, and I'm sure Sir Charles George was there too. And so suddenly this idea had got an enormous, impact. As we moved on, it became obvious for two major reasons, or actually one major reason and one minor reason, that fetal origins of adult disease was not what we should be thinking about, that we should be thinking more widely than that. And so FOAD morphed into DOHaD, and those of us involved in discussing it thought that we needed to include pre-conception events, so we needed to include postnatal events, infancy, childhood, even up to adolescence. So the development word replaced the fetal word. And we also, because of David's leadership, had realised, and Alan indicated this, that these phenomena that we were discovering operated across the normal range. This was natural history. This was a part of normal human biology. And we were understanding some of the mechanisms and seeing how sometimes that biology could lead a particular individual to a higher risk of disease. So we needed to talk about health as well as disease. And so at the Brighton meeting, an international society for DOHaD was formed. I remember sitting at home one rainy Sunday afternoon sketching this little logo and wondering whether it was too crude for the job, but it seems to have stuck. There was a minor reason for changing from FOAD to DOHaD though, and I wasn't sure whether I should tell you it or not actually, but given that our Prime Minister explained something about the F word in a speech in Scotland, I think last week, I thought perhaps it would be okay. Perhaps I'm just an old fogey. And really it happened because a postdoc from Canada emailed us and said, well, in my world, and this, remember, was the beginnings of the world of social media, FOAD only stands for one thing, and it's F off and die. And so whilst that was kind of appropriate, and David and I thought it was very amusing, we decided, well, actually, perhaps we should change to DOHaD. DOHaD has really gone viral now. Just quickly looking at Google a couple of days ago, nearly 250,000 hits on Google Scholar if you use that term, over 1 million on Google itself. It's over 10,000 just in the last year, and 43,000 on. So clearly the term, which you wouldn't have found at all in the early part of, in the noughties of this century, has now increased its uses massively. The DOHaD Society is flourishing. We now have members from 57 countries, including some like Iran, when we're not even able to take membership dues from them. So truly an international initiative. And David, because of his travel and his ability to get on with just about everybody, spawned a series of DOHaD societies. This one, I think, is probably the beginnings of the Japanese society. This is Professor Fukuoka, Hideyoki Fukuoka in Japan. And I'm not quite sure what David's minder is doing here, carrying his briefcase, I think. But you can see the engagement. Actually, David appears in this photograph twice, because if you look over here, the paparazzi here is not sure whether it's more important to save his beer or to snap David, and he snapped David, very wise. And in fact, when I went to the meeting of the Japanese DOHaD Society earlier on this year, you could see the number of people, many of them young, who attended. So another little seed, another little conception had grown into a very healthy and thriving organism. As Alan said, when we met in Portland, Kent's beautiful meeting there, co-organised with Susan Bagby and David, it was at exactly the time when the United Nations were meeting, and their famous Clause 26 in the political declaration of the high-level meeting on the prevention and control of NCDs says, "We note also with concern that maternal and child health is inextricably linked with NCDs and their risk factors, specifically as prenatal malnutrition and low birth weight create a predisposition to obesity, high blood pressure, heart disease and diabetes later in life, and that pregnancy conditions such as maternal obesity and gestational diabetes are associated with similar risks in the mother and her offspring. well, you can see the fingerprints of many senior DOHaD Society members all over that little piece, which was the first time internationally this had really been recognised at this level as an important aspect of NCD prevention. In 2013, when the WHO produced their action plan for the prevention and control of NCDs, one of the overarching principles has a life course approach, which starts with maternal health, preconception, antenatal and postnatal care, maternal nutrition, breastfeeding, etc. And so at WHO level, the idea is very clearly now part of the agenda. And in fact, as Alan mentioned, this year at the World Health Assembly, the Director General Margaret Chan launched a commission on ending childhood obesity, very much her own personal agenda, because tackling obesity now represents an important opportunity to reduce the impact of heart disease, diabetes and other serious diseases in the future, whilst of course improving the health of children. So Sir Peter Gluckman is co-chair of the commission. He was, of course, first president of the DOHaD Society, and I have the honour to co-chair one of the working groups on science and evidence, reporting directly to the Director General. When we met in Singapore, one of the challenges, which actually I think Richard Horton gave us, was to come out of the wilderness and link to other societies interested, other civil society groups and NGOs interested in precisely the same area, so that we could work together. And over the last 6 months or so, we've now managed to forge a link leading to a policy document, which was again broached in May of this year at the World Health Assembly, on leveraging early life opportunities to prevent and control NCDs. And you can see here how the early life side is, we argue, the way to prevent the bad effects of later lifestyle issues leading to risk of non-communicable disease. And it's an alliance between the NCD Alliance, which is a very large group, probably more than 200 civil society organisations, the Partnership for Maternal, Newborn and Child Health, which involves UNICEF and some aspects of WHO, and NCD Child, as well as DOHaD. And then, and I think it's a terrible shame that David didn't live to see this statement. Perhaps on the world stage, a small statement. For those of us in the UK, an enormous piece of evidence that the tide had really changed, from Sally Davis's annual report of the CMO, which actually came out in the Lancet in October 2013. The evidence base for the life course approach is strong. What happens early in life, indeed in fetal life, affects health and well-being in later life. David really had stuck to his hypothesis. He'd gone on to find the mechanisms to inspire many, many investigators, researchers in many fields, and to make this a truly global movement, which is very healthy, but which has a huge job to do in taking things forward. I'm sure that you are all members of the DOHaD Society. There's one or two people I know are not. They wouldn't, of course, be deans or anything like that. But you must join the DOHaD Society if you've come along today to take the heritage of David, his legacy, forward. And of course, Shane Norris, who will be joining us later on when his plane gets in from Cape Town, will be telling us about the meeting of the Society in 2015 in Cape Town, the first time we've gone to Africa. Do pick up a leaflet from Jane out there and register for that meeting. Thank you ever so much for coming and for listening.